We find ourselves in the middle of a mental health crisis. When all other markers of health and prosperity seem to be on the rise, our mental well-being seems to be struggling. According to the National Institute of Mental Health, 21% of US adults have experienced a form of mental illness in the last year. Addiction, depression, anxiety, and PTSD seem to be common day in our society. We numb ourselves to the truth of it through endless entertainment, social media, shopping, working, and drugs. The crisis has even the most knowledgeable in our society guessing at its causes. Maybe some answers are to be found in the very spots we are choosing not to look. It can be said that our own personal struggles are often best dealt with by confronting our own shadows. But what if we are doing the same thing as a society? What if some of the solutions are in plain sight and we're just too scared to confront them? What if the solution is to be found in this? Psychedelics may be that very shadow. Psychedelic assisted therapy is one of the most groundbreaking mental health therapies available. But I believe we need to get out of our own way to allow it to happen. When looking into the research behind psychedelic assisted therapy, one of the first things we will notice is that it seems to be used for everything. In patients with alcohol use disorder, reductions in alcohol misuse and increased abstinence were connected with the administration of a single dose of LSD. Psilocybin has been successfully used for the treatment-resistant depression of cancer patients. Troops suffering from PTSD have found a helpful therapy in the use of MDMA. If these research studies are legitimate, then there must be a similar underlying issue that connects all of these conditions. Whatever that underlying issue is, it seems psychedelic assisted therapy is helping with a myriad of the illnesses. Considering the scope of the crisis on hand, I believe a form of therapy that can help with multiple manifestations will empower us to properly help the individuals in need. Not only is this therapy helping with a myriad of conditions, but the efficacy rate is also something to be noted. In a study done with psilocybin for treatment-resistant depression at Johns Hopkins University, 6 months after the final session of treatment, around 80% of participants showed clinically significant decreases in depressed mood and anxiety, and around 60% showed symptom remission into the normal range. In a day and age where we are always hunting for more efficient ways of moving through the world and addressing issues, it makes sense to take note of the studies that are showing exceptional efficacy rates, even if the means of achieving them may take us outside of our usual comfort zones. Other barriers in mental health treatment are time and cost. Going to weekly therapy sessions is a strain on our busy schedules. Psychedelic assisted therapy generally consists of 3 sessions. There is an initial meeting with the practitioner, followed by the psychedelic session, followed by a post-integration session. With successful remission of symptoms from the earlier noted 6 months and beyond, I believe the juice is worth the squeeze. The cost of these sessions will vary based on the facility and the facilitator, but considering it will just take a few days of therapy versus continued weekly therapy, I believe the cost difference factored over time to be significant. I believe it will be vital to our well-being as a society to continually ask for the proper questions and follow the answers to those questions wherever they may lead us. Psychedelic assisted therapy may feel taboo. It may make us uncomfortable to talk about. It may cause us to question pre-held beliefs. But with psychedelic assisted therapy showing strong efficacy treatment for a myriad of mental health ailments, while at the same time lowering the barrier to entry for therapy, I believe we need to confront those shadows and open up dialogue about the new frontier of mental health treatment. Thank you.